but very, very warm welcome to our session. And so this is International Coaching Week for this year. So we're delighted that Lucy and Cornelia and myself have created this panel discussion for you to explore the link between coaching and the caring profession. And before we introduce ourselves, could I ask you to put in chat your connection with the coaching profession? Now, obviously, you're connected with coaching because you're here, but we'd love to see what your background is. Where have you come from in terms of the caring professions? You know, have you been in social work, teaching? Have you been in community care in some sort? Have you been in nursing? Put your experience in chat while we introduce ourselves. So, Lucy, would you like to say hi and just share your journey, really, to getting to the connection between caring professions and coaching?
Absolutely. Well, thank you. Thanks, John. And lovely to be here with you and Cornelia too. So for me, where I've arrived at now, so what I'm doing now is I'm a psychotherapist, an integrative psychotherapist, so trained with a background in person-centered counselling, humanistic counselling, psychodynamic psychotherapy, and CBT was my core training in psychotherapy. And then from an executive coaching perspective, I'm with the EMCC as an accredited senior practitioner and a systemic team coach and coach supervisor. My journey to get to that, and ultimately what I'm doing now, which is an integration of all of those things, is I originally came from a media background. So I did 20 years working in the media industry, and got to a particular point and really found myself thinking, for various personal and professional reasons, what is it that makes us struggle? How do we develop healthy and unhealthy coping mechanisms, and what really helps us to thrive? So I think that when I was reaching a particular milestone age of about 40 was what drove me to transition into this career now. But it's been really, I feel very lucky now to be able to be working in this way, in the way that I am now, which is that integration.
Lovely. Thank you. Thank you, Lucy. And before I ask Cornelia to share her journey, just to say that I gave you a wrong instruction. I think you have to go into the Q&A section rather than the chat. This is a webinar structure, not a meeting structure. So please try again, Becky and Helen, if you could have a go in the Q&A side rather than the chat side. Thank you. And Cornelia.
Yeah, thanks so much, John. Lovely to be with you and Lucy today, and thank you to everyone who's also joined the call. And like John has already initiated, we're really curious to understand who's joined this webinar today and what their background is when it comes to coaching, but also their interest in caring and profession and how that all intersects. Like Lucy and John, my work, I come from an integrated background as well. So I started my career off also in media, actually, Lucy. I hadn't realised that about yourself. Before transitioning into work in leadership development. And so worked in leadership development for a number of years before I became really interested in behaviour, emotions, human cognition, and what it was that actually drove leaders to think and feel and behave in the way that they do, and how leaders can optimally function to bring the best out of themselves and those around them. And that's when, about 10 years ago, I moved from deepening my coaching understanding, my coaching practice, to move more into understanding coaching psychology. And so now I'm really proud to be a chartered coaching psychologist with the British Psychological Society, and like Lucy as well, also accredited by the EMCC. So I'm bringing in my work very much focused on how do we develop leaders, but how do we also develop them through an understanding of coaching psychology. So in essence, how do we draw on all of the evidence base and the scientific understanding of human behavior, emotion, and cognition to help us formulate how we move forward in a situation. So how do we achieve a certain goal through that understanding of what might be going on for someone emotionally or cognitively, and help them find a path through that.
Yes.
In terms of the caring professions, have experienced my main capacity of my work and also my organisation is supporting managers and leaders to be the best versions of themselves. And I've been fortunate to do that a lot in the education sector, also a little bit in the social care sector, and also the care sector itself. And I've seen firsthand the real benefits that having a coaching understanding in those professions can have in terms of how we think about developing motivation, engagement, and confidence of our staff and of ourselves. So that's why I think this is a really interesting topic, and keen to see what everyone else's backgrounds are here and what questions people have.
Yes, yeah, indeed. And people are responding. So thank you very much indeed. And a lot of really interesting careers that people have had. I spot nursing and education, and quite a lot from different backgrounds. Just say a little bit myself. I started out as a Gestalt psychotherapist for some 20 years, but also my curiosity, I became then managing director of the Gestalt Centre in London, which meant I got interested in the business side of running the centre. And that took me then into how does Gestalt then link in with other business conditions, and especially teams. So I was using Gestalt in organizations, and then spotted this thing called coaching that seemed to be kind of linking what I was doing, Gestalt in organizations, with this thing round about 93, 95. And so started the Academy of Executive Coaching because I thought there was this synergy between what I was doing in Gestalt and what I was discovering as a leader of an organization, and studying a team development in organizations. So, but between the three of us, it really begs the question, what is the distinction? Where is the boundary between coaching and counseling psychotherapy? How do you make a distinction? And I'm often asked this question, and often people who are psychotherapists say, so how do I introduce what I'm doing? So kind of interested to hear how you describe to your client, especially if it's a client coming for coaching, how do you share what it is, and when you shift, if somebody's come for a coaching contract, do you let that stray, maybe is the word, into psychotherapy? Or so wonderful gray area this. So great to talk to you about it and hear your views.
Yeah, absolutely. Well, I'm happy to take that. You mentioned the psychotherapy and coaching and the grey area, and I think being able actually to inhabit that grey area and be able to sit with ambiguity, uncertainty is actually one of the quite powerful things that we can bring as practitioners. Interestingly, to your point about what is the boundary and how do we work with that, it's really interesting. When I was doing my master's in my final year for my research, because I was also qualified as a coach, I started looking into this in more detail. What is this? And what I found was there's so much research that has been done about the differences between the two, and less about the similarities between the two. And the way that I understand it now, actually, and it was so interesting just hearing Cornelia talk about her work there at the beginning as a coaching psychologist, is ultimately the way that I see us as human beings is that we exist somewhere on a spectrum of very high mental health to lower mental health to high performance and lower performance. And generally speaking, we kind of move up and down that from one end of the other. And even then, it's not black and white, because you can have someone that's very high performing in theory at work, but actually is struggling quite significantly with their mental health, possibly unknowingly, or their physical health. So I guess what I'm saying is, for me, there's a spectrum.
Yeah.
Traditionally, we might see, the executive coaching with the very high functioning, strengths-based forward focus, and the counselling or the psychotherapy right at the other end, with people in quite significant distress and not functioning. But actually, I don't know about Cornelia, I'd be interested to hear, but there's actually a lot of people that really benefit from the work who are somewhere in that middle place. And so if you're thinking coaching probably strays towards the middle, in my mind, really great counselling and therapy also comes towards that middle, helping people change. The boundary is perhaps somewhere, if there was one, and I think there is one, is possibly somewhere in there. And to answer your question about how I work with clients, I'm very transparent now. I have fully integrated my practice now. The way that I describe my integration is as therapeutic coaching. Other practitioners don't describe it in that way, but what I'm interested in is what the work is. So clients will come to me and say, often they'll say, I'm not sure if I need therapy or coaching, but I've come to you because I know you're able to work with both. And so then the work begins, and it tends to be an integration depending on what it is that's going on for that client. And there's of course detail there, but I'll pause.
Okay, and Cornelia, how do you, or if you do make a distinction, how do you describe it?
Yeah, so when I'm thinking about my work, and I suppose the schools of thought that I'm coming from, so just to give a bit of context on that. So when I'm coming forward as a coaching psychologist who specializes in leadership development, who has done a great deal of research into positive leadership. So what is it that we know helps bring the best out of individuals and those around them? So what are the key resources that help people be the best versions of themselves and the best versions, and help others to be the best versions of themselves? So whilst I'm not necessarily going to have people come to me who are necessarily seeking a therapeutic approach, like Lucy, people often also talk about, say, coaching as therapy through the back door. We've all heard that kind of phrase before. So I will have people coming through to me and my practice as a coaching psychologist. And I think particularly when people hear the word psychologist, they can think, oh, get that confused with therapist, and this person is therefore a therapist. And so therefore I can bring my presenting challenge to that person. But like Lucy, I'm a firm believer of us all existing on a dual continua. And I'm passionate about the work of Corrie Keyes, who really identified the fact that human beings exist on dual continua. So we can be incredibly high performing, as Lucy has said, and experience all kinds of positive emotions. And we can equally be experiencing some symptoms of mental illness. So it's not uncommon for me to work as a coaching psychologist in developing a leader who also has been through therapy or is going through therapy. But in terms of how I make that contracting work really clearly, as Lucy has said, I'm very transparent around what the needs are of that individual, what the needs are of the team, what the needs are of the organisation, and therefore present, well, if those are the needs, this is what we can do in terms of resourcing to support through coaching psychology, through positive leadership, for example, or here's where I might signpost you to work more with a therapeutic setting. So I'll make sure that the boundaries are clear. And I suppose one way I distinguish it in my mind, and John, I'd love your thoughts on this, and Lucy's as well, and perhaps anyone who's listening here, is when we're working with coaching psychology, we're very much thinking about how can someone perform and feel better moving forward. Whereas I think in the therapeutic space, and where I might signpost someone where a coaching solution isn't going to be best for them, is where they might want to do some deeper processing of the past and therefore would be better suited to go and work with someone who is a psychodynamic therapist, is a therapist, is someone more experienced in Gestalt, that will find that more useful in order to help them do the more forward-thinking work. However, equally, I have colleagues, and I'm sure, John, you're the same, and Lucy, you're the same, who are therapists, who are psychodynamic therapists, who are helping people also think about future goals and being future orientated. So it isn't as black and white. I think it is really important, and part of our training is about us making sure we are very ethical, reflective, competent in recognizing when and where we can offer the most support, and making sure we formulate that and we co-construct that with our clients so they understand what the different offerings are and what they can therefore work from and get the most from working with people in different ways. But you know, any manager or leader I'm working with will be somewhere on the dual continuum at any given time, and it might be in a coaching contract that person's situation can also change, and so there's a constant recontracting going on about what's most suitable and where one can help. But I think having the integrated training is so beneficial because it allows us to steer more into the grey perhaps than someone who may has just a very isolated training might feel comfortable to.
Yes.
Yeah.
Can I make it, see if I've got this right? So Cornelia, you say there comes a point where you would say, actually, I think I need to refer you on to a psychotherapist. Whereas Lucy, I think you're saying I would simply recontract. I wouldn't refer on. Is that right? That's what I'm trying to get clear. You would recontract and say, I think we need, or maybe it's in the contract and you just continue. But clearly, Cornelia, you're saying, no, there's I need to refer on. Is that right, Lucy? Do you?
So sorry, just to re-clarify for me, John, it really depends on the context. It really depends on what someone is bringing.
Yes.
As to whether I think coaching psychology or a methodology from psychology based on scientific understanding, based on evidence, will be most useful for that person. I will never say to someone, I cannot work with you or support you, because I think that can be very detrimental to them. I will explain to them what it is I can do within my competence that can really help them and what they feel comfortable to do. And I also will explain to them what the different options therefore are of going to work with someone with a different specialism or different criteria. Because I think there's always that danger that if someone is isolated or left on their own, that they don't seek the support that they need. So I think it's just about letting them understand the different fields of support that are available and what the different areas can be. So I just wanted to clarify that.
Yes.
And
No, so I've got that you would offer the support, but at some point you would say, as I would do if I'd taken a coaching contract, I need to refer you on. But I think, Lucy, you would not refer on. You would simply expand or extend your contract. Is that correct?
So depends, I think, is the
we need to give our audience a little bit more clarity, I think. So if you could be clear, if you could maybe make it a little bit more black and white than we all know it is.
Clarify the nuance. And I'm also aware that I can represent myself here. I'm also aware that other people work slightly differently to me as well. For me, generally speaking, that initial session for me is really about understanding what's going on for somebody. You know, that first session is to understand. I mean, Cornelia made a great point there about coaching can often be a really accessible way to get people in to talk with somebody when actually they do want to discuss something that is potentially a deeper mental health issue. Men are a classic example, sorry to generalize, but then there's been research from the BPS which shows that men are significantly more likely to want to access coaching than therapy. But this affects other groups as well. So what I would say is, after that initial, we might have an initial free of charge chat. For me, that first session is really trying to understand what it is that someone wants help with. And I think by the end of that initial session, you've got a better idea. Now, as a result of that, there have been occasions when I've said, actually, it sounds to me, based on what you're coming to me with, is actually what you really need right now is psychotherapy. And that's going to mean probably weekly support, a 1 hour, 50-minute session. And therefore, Either, if that's not something that I would be able to offer at that particular time due to the fullness of my practice, I would refer them to the various, I've got lots of lovely colleagues who I'd really recommend for that. Saying that, that's quite rare. Generally speaking, what I find is the people who find their way to me are what I would call mostly pretty well-functioning people who are struggling with a particular challenge that requires a solutions-focused way of working. And that's the way I describe the way I work. I'm solutions-focused in the sense of what is it that you want to change? And what would I draw on from my various toolkit of coaching methodologies or psychotherapeutic modalities? What would I draw on to help you move forward? And then as Cornelia, I love the way Cornelia said co-creates that kind of planning. I quite transparently say, this is the kind of thing that I imagine our work to look like.
Yes.
And then off we go with the work. What I would say is that occasionally what you'll find is in your work with, whether that's in leaders within organizations, is that sometimes what will happen is I will become aware quite often before they've become aware of them, something that's happening which is a bit more deep rooted that I feel is maybe blocking their ability to move forwards. So for example, it might be I might become aware of their attachment style, an insecure attachment style, which is affecting them within some of their work.
Explain that to our audience. That's I understand, but that's a technical explain in more layman's terms, attachment style.
Okay, so from a psychodynamic psychotherapy perspective, it comes from the understanding that Bowlby, the understanding that we learn our early ways of relating to other people, depending on the care we're given at a very early age, and it becomes an unconscious script that we adopt that affects how safe and trusting and able to be free in relationships that we are. And so it can show up with people. At that point, then it then becomes a conversation whereby, and I suspect, I'm coming through strongly from Cornelia, so much of what we do is about helping someone understand themselves more and in self-awareness, grow their self-awareness so they're more empowered to make different decisions. So, something might come up around then. And then often you can be I find, so with the people that I work with, they've often come to me because they're very psychologically curious anyway. So I'll often say, well, would you be interested in understanding something around how you relate to other people from this perspective? Or I might refer to transactional analysis. That's another way of working that is really useful and helpful. And all of the leaders that I work with find that really useful and helpful. It's also becoming apparent that's really helpful from a neurodiversity coaching perspective as well. We're always talking about, from a leadership perspective, how do we influence others and how do we feel about ourselves? So does that help?
Yes. No. Yeah. It's opening up the whole conversation, and I'm hooked by this notion of the attachment style, which of course is, as you say, it's about how we attach early on to our immediate caregivers, usually the mother, and whether we build that strong bond. I'll drop in now. One of the distinctions I make, and the reason I moved out of psychotherapy, is that it does require continuity. One of the distinctions I make is that as a psychotherapist, I'm expecting my client to be dependent on me for a period, or for maybe a substantial period. I might be thinking 6 months, a year, 5 years of once a week, twice a week, 3 times a week. To me, that is, you're exploring the early attachment between the infant and its parent, and that's the exploration. Whereas as a coach, I'd expect to meet someone, they're self-managing, their attachment is fairly solid, and they're dealing with how they engage in their lives. But there's one interesting and really quite challenging question in the whole of the psychotherapy is, how do you know that someone is either neurodiverse or has an attachment issue? Because they show up as very similar, because the whole issue about attachment is that we have difficulty making connections. We have difficulty attaching. And of course, what we know is some people who are moving on the spectrum, neurodiverse, autistic, naturally do not make good relationships. And of course, these show up in organizations. So kind of curious, I mean, there's no answer yet about how we make a distinction between it, but your thoughts, your experiences, either of you, of this complicated issue. How would you spot it? How would you diagnose? How would you identify if it's one way or the other? I have this in supervision, actually. This is always an interesting case in supervision.
Yeah, I suppose from my perspective as someone that's working in leadership development and as a coaching psychologist, it's not my role to diagnose. It's not my competence to diagnose someone's neurodiversity. It's in terms of attachment style, and going back to what Lucy suggested, it might be something I notice, and neurodiversity might be something I notice. And whether I am feeling that it's the right thing to raise with the client will depend again on the client, what they're coming from, what their issue is, what they're trying to work towards. But I suppose it's being very curious with them around what I'm noticing and sense checking whether some of the markers of, say, for example, dyslexia or autism are indeed what are coming up in that conversation, or could they be related to attachment, and me just sharing with them what I'm being curious about in a really sensitive way.
Yes.
Not necessarily always putting markers or labels or names on things,
Of course.
because as you said, there's no black and white answer to these things, and it can be intertwined, it can be mixed up. And I'm rereading Body Counts the Score and just thinking again about trauma at the moment and how that shows up. And obviously we know the big links between attachment and trauma. And though, as we know, going back to what you were saying there, John, neurodiversity, attachment style, trauma can affect the way people interact in relationships. I suppose when we think about neurodiversity, there are so many strengths that can build out of neurodiversity. And I suppose, looking at the other side, the flip side of trauma and attachment style, there are some benefits of different attachment styles and trauma experiences, although it can be difficult to explore those. But I suppose going back to your question, I would be very curious, I'd be very sensitive, and I would try to understand whether it's something that has crossed that person's mind before, because also we're dealing with the realms of consciousness and subconsciousness around some of this too. And I think we'd make sure at the very beginning to take a deep case study, case formulation, to understand what does the person already know about themselves? What are they already working for? What do they already want to share? And it might be, for example, some of the things that commonly come up with, for me, would be working with a leader, for example, who's in their 50s at the moment, who believes that they've got dyslexia, for example. If I take dyslexia as one example, has never really fully explored whether that is the case or not, doesn't feel the need to get a diagnosis around that, but recognizes what that might influence, or would like to understand more about how that might influence how their brain conceptualizes things, and is very well able to join the dots around things. And so I might share some of what I understand about that neurodiversity with that person to see if it's something that connects to them, and maybe signpost some reading. But I think it very much depends on what that person is willing to explore, what they're open to exploring, and me also recognizing, well, if, for example, another thing that's come up quite regularly in my practice is leaders being curious about whether they're autistic or not. And me suggesting, well, these are the different pathways you could go to if you wanted to explore that further. And here are some clinical psychologists who could help you explore that further again. And just being open about that and signposting and being curious, but obviously not in my capacity making a diagnosis.
Yes. But that not because, of course, you could be a psychotherapist or a psychologist that's trained in neurodiversity. So then presumably you would feel able, I mean, take out the word diagnosis, but to kind of give some indication of what might be happening, which is part of our job, is to direct people. Yes. Yeah.
And I suppose I when I'm working with people, I'm thinking more about people's values, more about people's psychological strengths. So that kind of sits outside any buckets of neurodiversity diagnosis. And so it, in a way, delabels some of that terminology. But like you said, John, it's very useful then to perhaps work with or seek coaching psychologist or a therapist who is very experienced in working with, for example, autism or ADHD.
Yeah, lovely. And Lucy, neurodiversity or attachment styles, do you have any indicators really for our audience here? So I'm assuming, since neurodiversity is still relatively new and the training is still quite limited, that most have not had experience of that. Have you any indicators of when you might identify rather than diagnose more of an attachment issue, or clarifying it's neurodiverse?
Yeah, I think what's important to say is that the way that I have been trained psychotherapeutically, which I also now apply to all of my work with all of my clients, is around how to formulate an understanding of what's going on for that person.
Yes.
So the thing, that solutions focused part is what they're bringing that they would like to change. And for me, that's kind of like the North Star that we're always moving towards. Now, whether I notice something along the way, if it's not related to their North Star, I probably won't ever bring that into the room because it's not necessarily going to be in their best interest. So that's the first thing. You had your finger.
Sorry, can I interrupt? But if the client, and this is true for attachment and neuro, turn up and say, look, I'm not shaping up as a manager. The feedback is I'm not relating to people well.
Yeah.
That can be either new. If that's the presenting problem, you then have to work out.
I agree. What I was going to say is a part of the formulation is I adopt the 5 Ps model, and one of the Ps is protective factors. Now, if I identify that one of the protective factors for this person is the strong relationship they have with their father, and I understand that actually part of their relationship with their father is what's led to perhaps an unhealthy relationship with their male boss, for example, I'm going to be working with that very, very carefully. From a psychotherapeutic perspective, I will help them move towards their coaching outcome that they want to have, but I'll also be mindful of the deeper psychotherapeutic work that would be required to go to that place to really work through that attachment. So what I'd be looking to do with that person around, if we were talking about that from an attachment perspective, is helping them to understand themselves, how they feel in their relationships in the here and now. Because remember, we understand the past. We want to understand the past in order to help someone in the here and now in the future. Yes. So I'd be looking to do that with this person to help them understand what is it that's going on for you in this relationship with your boss that's finding difficult. And then ask the kind of strong coaching questions or psychotherapy questions that help illuminate those blind spots that might be going on, any self-limiting beliefs, any scripts or attachment dynamics that are playing out, that we can start loosening some of the fixity around the beliefs so that we then start this person feeling like they have a more healthy relationship with their male boss in the here and now. We might never have had to go to the point of attachment. To your point about whether that's, diagnosing neurodiversity versus anxiety versus, there's so much comorbidity around so many of these things. For example, I have people, one thing I'll say in terms of neurodiversity, I have so many people that come who say, I think I've got ADHD, for example, or I think I've got autism. So they will bring it into the room. And of course, that makes it very, very transparent. There's very, very few people now that I see that I think, I wonder if this person has got ADHD and they haven't already thought of it themselves. But interestingly, we also know there's comorbidity around there's more likely to be addictive behaviors with ADHD. There's more likely to be people-pleasing behaviors with ADHD. There's lots of other things that are going. People are much more likely to feel anxious and depressed with neurodiversity neurodivergence, I should say, for example. But to your point, the work actually stays the same. So whether somebody is pre, during, or post-diagnosis, actually the work that you do with that person, whether it's the coaching work or the psychotherapeutic coaching work, the work is actually pretty similar, regardless of whether they've had put a label on it formally or informally.
Okay, so one word you used in there might be comorbidity. I can't even say it myself. Do you want to just say a little bit about what that means?
Can I throw to the psychologist, who can probably explain it even better than I can? But yeah, ultimately it means that there's more than one thing that's showing up at any given time, ultimately. And we know that for certain, I mean, personality disorders is another really interesting one, and I'd love to know more about Cornelia's experience of working with, personality disorders from a psychotherapeutic perspective. That's been fascinating for me, because people come with diagnosed personality disorders that have caused severe disruption in their lives, and they're medicated, and we can very clearly work with it psychotherapeutically. In the coaching world, we know that certain leaders will display traits of, say, narcissistic personality disorder or sociopathic traits. And so, that's interesting to hold that awareness of that in the coaching world. And I can't remember what made me think of that, but about comorbidity, wasn't it?
Either way, I'm just thinking about the coaches that are here on the line who don't have this experience. They begin to sense that there is something happening in this comorbidity element, and for them it would then be a case of referring on. For those of us who are psychotherapists, there may be an opportunity to refer on. But can I pose a really interesting? I had a supervisee who was working with a female client, built up a really strong relationship over time, and it emerged that she was feeling threatened, sexually threatened by her boss. In the exploration of this, she then revealed that she had been sexually abused. So, as supervisor, I'll share what I did. As supervisor, what do you say to this coach who isn't experienced in psychotherapy, has a very, very good understanding, has done a lot of personal work, and has some understanding of it? But this is not an unusual occurrence if you move in that sphere of opening up the more profound experiences. So I put that to you. You either you end up with a client that eventually says to you, I was sexually abused as a child, and this is now stimulating all of that trauma. It could be any trauma, but this just happens to be an issue that I had to address. So then, and this will be for our audience here. It could be some other level of trauma, but just curious, in this instance, how would you proceed, either yourself or, as in my case, with a coachee, a supervisee that didn't have anywhere near the expertise to address something as significant as this. Do you have any?
Yeah, so I mean, I'd love to know how you did deal with it, John.
Okay, if you want me to go forward,
yeah,
I can share that first. But to me, that's this boundary. Where do you go? And it's a very delicate one, especially now. And we're talking about being trauma sensitive, which means being aware of how far can you go. Because, I mean, I'll share a bit more about what I said to the coach, is that, of course, you can't ignore the issue, because otherwise you compound the secrecy. If you as the coach, I can't, this isn't my territory, go somewhere else. The risk is that you deny the experience. So the first thing I said to him, I said, you have to acknowledge what you've heard and reflect back, and clearly state that it's not your area of expertise, and you would support the referral to a trained psychotherapist who was used to that. But curious, because Lucy, of course, you because of your experience, you had would you then, with your experience, transition to working with the abuse, the trauma, or would you say, no, that wasn't within our contract originally?
It's a really interesting question, and in reality, I'd want to know a lot more. The way that I understand trauma is that it's not necessarily what's happened, it's the impacts that it has on you.
Yes, absolutely.
Double mate sense of trauma is what happens inside of you, not what happens to you, which is why people can have different reactions to the same traumatic event. But in this particular incident, I would wholeheartedly agree with your approach. And to build on something that Cornelia said earlier, the relationship that you have with this person is absolutely crucial. If you've built up a coaching relationship whereby this person has now revealed to you, in relation to something they're experiencing in the here and now, something that belongs in the past, the relationship is one of the most healing aspects of anybody to come through that. So I would be encouraging this person, this coach, to be able to use that relationship to provide some of the healing and moving forwards. And I guess the things I would be curious to understand from this person would be, having recognized that the link to what you're experiencing now is something that exists in the past, what would you like, how would you like to work with that? Because not everybody is going to want to then go and open that door, and that's in my experience. I've worked with people who I know are bringing trauma. They're not ready at that particular point in this particular time of their life in this relationship to go there. So I would be curious about that. You mentioned the trauma-informed approaches, and I think, this is really important around, I've been speaking to some really great trauma-informed practitioners recently who are not counsellors and psychotherapists, to really understand the movement of this. And, my understanding is it grew because it was designed to, trauma-informed approaches were designed to support anybody helping another human, whether that's a nurse or a coach or a teacher or a social worker, to help. If trauma enters the room, what do you do? How can you help that person in the here and now feel safer and more regulated, so that perhaps then they can be ready to then go back to the coaching to say, okay, and how would you like to address this with the original problem that you brought with your boss, for example. But in terms of if somebody brought this to me in my private practice now, if we'd contracted to work with that psychotherapeutic coaching, this feels to me like something quite significant. If they then said, I feel like actually this is, having realized this, I found this very distressing, and it's something that I now want to work with, I might at that point, depending on where I was in that relationship with them and the cadence of our sessions, make a decision about whether it would be best to work with me on that, or whether it would be best to actually refer it separately to another practitioner.
Yes. Yeah. In this particular case, obviously the coach involved wasn't experienced. So I think I did what both of you would do, is encourage him to understand the impact of it, and then see what's happening in relation to her boss. What is having understood that there is some sort of trigger or some connection, what was it that she needed to do? And of course, it was childhood abuse. So I was encouraging him to see, how did she find her strength as a woman in the moment, to find a way of either making a complaint about this person's behavior, or finding a way of dealing with, or recognizing that it was just insensitive banter that he was engaged in, and actually did it with everybody. So I was encouraging the coach to explore the context in which he experienced this from her boss, with the understanding that this was a trigger. Fascinating area. But one of the other areas we were talking about is how coaching supports the caring professions. And so one of the questions I asked, suggested people put up, their background. I don't know, you can see them as well. What do you think, what is coaching adding to professions like nursing? I'm just having a look, social worker and teaching, having, I'm just seeing here somebody having worked in the NHS for 25 years. So what have you seen that coaching has done specifically for the caring professions? Has you seen it adding anything?
Yeah, I definitely a huge amount. I think, we're probably all a bit biased on this call. So I'm just going to point that out and say, we would all say that coaching could add value to all professions.
Yes.
I think where there's that kind of particular value add to the caring professions are working in the caring professions, very high tense, high pressure, high emotional load. So I think if you're integrating and bringing in some coaching to those environments, whether it's through a supervisor relationship or a manager relationship into the caring profession, you're adding a layer of a reflective space, a safe space, an opportunity to debrief, an opportunity to digest everything fully emotional and intense that can happen in the caring profession, whether you're a social worker, whether you're doing end of life care, for example. If you introduce coaching skills, for example, to a manager who's working with someone in those environments, or the manager themselves, we know that coaching can be incredibly empowering. It can boost confidence. It can boost well-being. So actually, it is the opportunity to really enrich, I think, that profession for people when you bring coaching skills into that environment. And I think it can have then a ripple effect on the whole culture of that particular organization when you create more of those reflective spaces, when you create those spaces where through a coaching approach, you take much more of a learning and growth mindset in terms of how we respond to issues that may not have gone to plan or may have gone to plan, and how we can continue to get even better at them. So I think it can really improve the quality of a working environment too. But again, I've got more to add on that. So I'll go back to John. You were going to further that question, I think.
Well, I just seen one of the questions here asking, what is the overlap of some of so they're asking specifically about techniques and support. So is there anything that you would think that coaching is really pretty good at and also connects across? Of course, Carl Rogers' active listening, unconditional positive regard, it really is the ground bedrock of humanistic psychology anyway, and of coaching. But I wondered whether, to respond to that question, whether there are other techniques, skills, approaches that you think are tie across to other caring professions.
I mean, to build on what Cornelia, I think Cornelia answered that question beautifully. I don't have much more to add on the things that coaching can really bring. Yeah, and you touched on there, John, that the Carl Rogers piece, the thing that really stuck with me, the powerful image, is the Carl Rogers potato, and we're all just striving ultimately to be the best that we can be. And some potatoes, unfortunately, don't have the best conditions to start with in life, but even if you put a potato in the dark and you don't water it, it will keep trying to grow. So I think what we do in coaching, when we bring that into the caring professions, ultimately what we can do is provide the conditions to allow whoever that person is and whatever they've come with to have the condition that they can grow. We believe in the resourcefulness of this individual person to keep striving to be the best possible version of themselves that they can be, whilst also recognizing that up to this point, maybe the conditions they've had have not been the ones that have been most helpful. So any of the behaviors and thinking patterns that we now see as being dysfunctional, they've come from somewhere. So we can hold a coaching space to help them understand, what are the behaviors that you've developed that are helpful to you? What is it that's not helpful? And how can we sift through that? And techniques, there's loads of different techniques, but we've mentioned a couple of them now around transactional analysis, in terms of relationships. How can you understand the way you relate to people better? And some forms of CBT, You know, some CBT aligns very well with coaching in the sense of trying to understand the link between the thoughts and the feelings and the behaviors. And when we can help someone break that down and understand their physiological responses, that is a really quite simple but very powerful way that aligns with coaching to help someone move forwards.
Yes. Yeah.
And
I'm just
sorry, John.
I was just
No,
conscious of the time and coming to a close. But yes, add something as
I was just
part
going
of
to
our
say, you know,
closing.
at a very simplistic level, things like the GROW model can be incredibly empowering in a
Just
manager.
explain that in case somebody hasn't. I mean,
Yeah,
can't
yeah,
imagine.
very good point, actually. A behavioural method in terms of really focusing on helping someone together to think about what's the goal they're setting out to achieve, what their current reality looks like, what options there are for them to move from their current reality closer to that goal, and therefore how would they like to move forward. So I think, you know, a manager working with someone in an overwhelmed caring sector can be supporting someone just to think a little bit more clearly about how they move forward with something. So yeah, just another tool, I think, to maybe build on some of what Lucy said more deeply there.
Yes, I was thinking maybe how might that apply to someone in you know, caring in a hospital, nursing. But
Thinking about how do I manage my workload? How do I manage these different challenges that are in front of me?
yes.
Circles of control model. What's within my control? What's out of my control?
Okay, just asking or inviting that conversation. Yes, indeed. Well, we need to draw to a close here. Thank you very much indeed. It's really interesting. I always enjoy I was going to say chewing the fat, but I'm a vegetarian now, so I have to find another expression for that. Just chatting together and exploring the boundary or the flow between the two. And I guess we'll have more questions. I guess maybe we could open up, and if anybody wanted to send questions through, we could respond to them separately. But thank you very much indeed. It's been a very rich conversation for me anyway. So I hope everyone in the audience was equally intrigued by the challenges and the overlaps here. So anything you'd like to say by way of closure?
Just to say thank you, everyone, for joining the call, and thank you for the questions that did come through. And as John said, if there's anything we can add separate outside of this call, then very happy to do so.
Yeah, just say thanks for having me. Been lovely to chat with you both. And yeah, I've really briefly, I can't multitask very well, but I've briefly seen some things in the Q&A about people that are excited about integrating their work. So yeah, let's all collaborate. That's what I'd say with other people.
Yes. And I'm reminded of something you said, Lucy, right at the beginning, that it's the quality of the relationship that is the biggest healing factor. We know that from 100 years of psychotherapy research. It's the quality of the connection. And, you know, our connection. Unfortunately, we don't have a connection with you, the audience, only through the Q&A response. So sadly, we can't build any more of a relationship. But to me, it's the essence of our work, and certainly the essence of Gestalt practice is about this quality of connection. Lovely. So we leave it there. Thank you very much indeed, and look forward to more discussions in the future. Thank you.
Thank you.
Thank you.